Hey guys, welcome to my channel. Today we will going to discuss the posterior part of the Norma Basalis. The posterior part of the Norma Basalis, as we discussed, is formed from the occipital and the temporal bone. So this is the basal part of the occipital bone, and the posterior part is starting from the anterior half of the margin of the jugular foramen till the external occipital protuberance. So this part is the basilar part of the occipital bone, and this part of the occipital bone has some condyle-like area lateral to the foramen magnum. These condyle-like area called as the occipital condyle that articulate with the C1 cervical vertebrae to form the joint of the vertebrae. Now, this is the occipital bone, squamous part of the occipital bone that have the features, that is the external occipital protuberance, the superior knuckle line and the inferior knuckle line. The temporal bone lateral to the occipital bone is forming the posterior half of the Norma Basalis, and in the temporal bone you can see the foramens that were the stylomastoid foramen through which the facial artery pass, and the hypoglossal canal lateral to the condyles of the occipital bone through which the hypoglossal nerve pass. The largest foramen that come in the posterior part of the Norma Basalis is the foramen magnum, through which the spinal cord, meningeal arteries, spinal arteries, anterior and posterior vertebral arteries, and different structures pass to the foramen magnum. So this is the explanation of a Norma Basalis, and the Norma Basalis is the complex part of the normas which is formed from the different bones. Now we are going to take a summary of the Norma Basalis that are dividing into three parts. There is the anterior part, middle part, and the posterior part of the Norma Basalis, and the external is from the incisor teeth till the external occipital protuberance. So the anterior part is formed from the teeth and the hard palate. The middle part is formed from the anterior half of the middle part is formed from the vomer and the sphenoid bone. The posterior half of the middle part is formed from the occipital and the temporal bone with various foramen and the fissures that are present in the between the occipital and the scaphoid, sphenoid and the temporal bone. While that of the posterior part of the Norma Basalis is formed from the basilar part of the occipital bone and the temporal bone. So this is the whole view from the occipital bone, where the various fissures and the foramen are present. That is the foramens. We will take a quick revision of the foramens, that are the foramen ovale. Inferior to the foramen ovale is the foramen spinosum. Medial to the foramen spinosum and foramen ovale is the foramen lacerum. Inferior to the foramen ovale and foramen lacerum is the carotid canal through which the carotid artery and the carotid nerve pass. Then lateral to the carotid